Now, we all know that there are a lot of myths in medical science, in any profession, in any science, which is more of a hearsay and cooked up data rather than the fact or evidence base. So, let us discuss in a nutshell what are such myths. Now, number one myth, which I do get to hear from a lot of patients, that if a cancer is operated, it is going to spread. So, they have this belief when you cut the cancer, it spreads. No, it is wrong. If this surgery is following oncological and oncosurgical principles, that you take out the entire tumor or mass with proper margins, with proper lymphatics, then the surgery is of choice. Surgery does not spread cancer. That's absolutely wrong and that's a myth. It spreads when the surgery is bad, surgery cuts through the tumor knowingly or unknowingly, or surgery is grossly botched up. So, otherwise, surgery is the solution. It does not spread cancer. That's absolutely wrong. It's just the opposite. Now, coming to the second myth, a lot of people believe that probably surgery is not needed for cancers. And cancers mean you treat them by medicines. No. Solid organ tumors, hollow organ tumors, barring the blood cancers and lymphoma and stuff like that, where chemotherapy is of choice. Most of the tumors, where there is a mother tumor, if it is not spread, so you cut it out. Now, whether you cut it out upfront or you do it after some sort of a neoadjuvant therapy is a question to be decided by the oncologist or the oncological board. But what is very important, that you need to cut out the part. So surgery is definitely needed. It's not that non-surgically cancers can be solved. Not all of them. The third myth about cancer, that biopsy is mandate for every cancer before you go for an operation. No. For hepatobiliary pancreatic cancers, where the access to get a biopsy is difficult, you do not have to do a CT or ultrasound guided biopsy to prove and then do a surgery, because that is based on signs, symptoms, radiology, tumor markers, a lot of things, and they're almost right in 90 to 95 to 98% of the cases. So you do not need a routine biopsy, because these biopsy tracks can have seedlings from the cancers, drop metastasis, etc. So you do not need a cancer biopsy in every case. But yes, having said that, if you can access the area, say you can take brush biopsy for a periampullary tumor, for a duodenal cancer, you can take endoscopic or colonoscopic biopsy for an upper GI tract cancer or a rectal or colonic cancer. So these are the areas where you're going through a natural tract, where the chances of seedling of the cancer doesn't happen. Yes, you go for biopsy, but it is not a routine that every cancer will need a biopsy to be proved and then only you go for surgery. So hepatobiliary pancreatic, mostly you can go ahead without getting a biopsy, because many of the time this so-called biopsies are true cut or a fine needle aspiration cytology or a fine needle aspiration biopsy, and they may be negative in spite of the fact that the tumor is there, because from the place from where they have taken the biopsy, the cells are not present. The report comes out to be negative, but actually there is an underlying cancer. So the third myth, pastor, is that biopsy is a mandate for every patient of cancer to decide on surgery. No, it is not the case. Last but not the least is that a lot of people believe that chemotherapy is a mandate for all cancers. No. Early stage diseases, lymph node negative diseases for colorectal, hepatobiliary, pancreatic, upper GI may not need any sort of chemotherapy. That is a decision to be taken only once the surgical specimen is sent for a histopathology, adequate studies are done, biopsy report comes. If the margins are negative, you don't have lymph nodal disease, it's a T1 or early disease, you may have a cure, you may not need chemotherapy at all. So chemotherapy is primarily needed for advanced stage diseases and for margins where there is positivity, or when you have lymph nodes which are positive for cancers. So chemotherapy routine mandate for cancers is also a myth which is untrue.